Well, welcome everyone to the webinar for the NIH Prize for Enhancing Faculty Gender Diversity. We are so excited to have you here with us today. We've got a really exciting presentation lined up from our team at the NIH. We'll also share with you how you can participate in the prize and then answer some of your questions. In this webinar, you can interact with us in a few different ways. If you look at the bottom of your screen, you'll see a Q&A box. If you have any questions for us, please put them into the Q&A box and we'll do our best to answer them at the end of the webinar. There's also a chat feature that you can use, but please do put your questions in the Q&A box as sometimes they can get lost for us in the chat and we'd like to make sure we can answer them or answer as many as possible. We're going to kick it off with some introductions. First of all, my name is Kyla Jeffrey. I am the VP of Customer Success at HeroX and really excited to host and moderate our webinar today. Also with me, we have Dr. Melissa Ghim. I will pass it over to you, Melissa, for an introduction. Oh, Melissa, you're on mute.
Just wanted to say that we're very excited to bring this prize competition, to have launched this prize competition. And this is part 2 of a 2-series webinar, and we hope that we are able to answer your questions here today. There will be a Q&A session at the end. We may not be able to get to all the questions, and if that's the case, we'll certainly answer them in writing on the form. Okay, so I'm going to pass it off to Dr. Donaldson.
I'm Teraya Donaldson. I am part of the National Centers for Advancing Translational Sciences, and I am involved with the launch of this challenge. And I'll pass it to Cecilia, who will start the presentation today.
Hi, everyone. My name is Cecilia Gaultney. I am a scientific consultant that is having the great pleasure of working with the Office of Research on Women's Health and Dr. Donaldson and Dr. Ghim. So thanks again for being here.
Great, thank you so much. So we're going to dive right into our presentation.
So yeah, we would just like to start out by giving you guys a quick introduction to the challenge. This is of note our second webinar. So the information in this is going to be a little bit more tailored to what you need to know at this point in the competition. However, you can go back and look at the first webinar. It can give you a little bit more background information if you're a little earlier on in the process. And you can find that on the HeroX page under updates. So our goal, the goal of the prize competition, is to recognize those institutions whose biomedical and behavioral science departments, centers, or divisions have achieved a sustained improvement in gender diversity, and to learn of those transformative structures, systems, projects, and processes that they used. We know that you all have some really amazing programs that you've developed and implemented, and we think that you deserve some recognition for that. A little bit of time to celebrate. So in addition to that, we also want to compile the lessons learned and also make an effective list of those approaches and the data that you guys provide us to prove that they are successful approaches so that other institutions can also enhance faculty gender diversity. This is a systemic issue, as we all know, and we'll all benefit from more effective approaches across the board. You'll also note that up in the goal, it does say department, centers, or divisions. So your program does not yet have to be institution-wide. It certainly can be, but it does not have to be. However, part of the judging criteria that Dr. Donaldson is going to go over does hinge on the scalability of your approaches, so do keep that in mind. What to consider at this stage? So we're looking for data-driven applications that really do support, again, the efficacy or impact of the program that you're describing that is enhancing faculty gender diversity. The prize is $50,000 to each institution. Up to 10 institutions will win with the best overall systemic approaches. So we may also potentially, if we get a lot of great submissions, which I hope we do, have some honorable mentions that are will have non-monetary awards. then we will have the winners event. So winning participants and honorable mentions and anyone else who wants to join can join. However, the winners will be presenting their approaches at the NIH Office of Research on Women's Health hosted scientific symposium. We will be inviting you to share all of the aspects of your program. So successes, the roadblocks, to really create an engaging forum where a meaningful discussion can occur. My colleague, Dr. Donaldson, will share more information about this event later in the presentation as well. Next slide, thank you. So we do get a lot of questions about eligibility, which we love, keep them coming. This slide does just go over the basic outline of the eligibility criteria, but of course, there is a much more detailed, longer list of eligibility criteria on the guidelines page on the HeroX site that we do encourage you to take a look at to make sure that your institution qualifies. So the basic criteria here, as you see, US-based accredited public or private academic institution. You could check that US Department of Database to see if you are accredited, listed as an accredited institution that can help you out. You also must be nonprofit, and you must grant baccalaureate or advanced degrees in biomedical, behavioral, or health sciences. You'll see a note here. All institutions, we've also gotten some questions about this, all institutions that meet the criteria listed here and on the website are invited to apply, including our R1 and low and limited resource institutions. I'll talk about this a little later. We also do want to clarify one point. So when you go and read those guidelines, there's going to be a guideline that says federal grantees may not use federal funds from a grant award to develop their prize competition submissions. We wanted to provide some clarity around this because we do realize that many of the institutions, maybe all, will have some sort of federal funding and will have it for a variety of uses and potentially directly for enhancing faculty gender diversity. So the clarification here is that institutions that receive federal funding are eligible to participate in this challenge, federal funding specifically to enhance your faculty gender diversity programs especially. You're eligible to participate in this challenge so long as the federal funds are not used to develop the actual submission to this challenge. And the submission may certainly contain some of the data and outcomes from the federally funded programs, but the preparation of the submission materials themselves should be separate and done using non-federal funds. We hope that provides some clarity. We will also have a Q&A session after this presentation. Again, put those in the Q&A box and we'll be more than happy to answer those eligibility questions at the end. Next slide. So in addition to those eligibility criteria that I just went over, you may also see language. It's really prominent. We wanted it to be prominent about low and limited resource institutions. We are encouraging institutions from this group to apply, but you do not have to be a low or limited resource institution to apply. So as you see here, the definition of a low or limited resource institution is that it has a separate one for undergraduate focused and health professional and graduate schools, but the basic idea is that you may not have received funding from the NIH totaling more than $6 million per year in 4 of the last 7 fiscal years. Seems a little complicated. However, thankfully, there are resources online that can help you identify the total funding that your institution has received, including the reporter tool. You can find links to these tools on the guidelines page under rules. We really want to see applications from the whole spectrum of institutions, as we've talked about before, because we recognize, one, that disparities exist, and also part of this challenge is that we want the resources shared after to work for everyone, not just one certain kind of institution. So part of our approach to encouraging applications from our low and limited resource institutions is that up to 5 of the 10 available prizes will be reserved for our low and limited resource institutions. And these institutions will be competing against each other rather than against the institutions that do not meet this definition. I will now pass it along to Dr. Donaldson, who's going to go over in a little more detail what we're looking for in your submission.
Hello, everyone. Thank you, Cecilia, for passing it to me. Really quickly, before we start with the submission requirements, I just want to give you a little bit of background also with the where this idea came from. So this was an idea that came from the Working Group on Women in Biomedical Careers out of the NIH, which is a trans NIH committee that was looking for some strategies and some tools to kind of, see where the slate in the landscape of gender faculty gender diversity is. And so we wanted to bring this challenge to you today as just another tool in the belt to see, what, as Cecilia had mentioned before, just really great ideas. And this is the first time that we're doing something like this. So we're really excited about bringing this to you, and hopefully we'll get a lot of participation from a variety of institutions. And with that, and is the submission requirements. So what we're looking for is it's different from a grant, but really what we want to look at is what did you implement? Like what sort of intervention that your institution has developed and had, and what's ongoing, and the thought processes around it, any challenges that you have seen or had dealt with in order to get this intervention, practice, policy up and running, metrics in order to measure like the pre-intervention and post or current ongoing activities to see like some of the changes that have occurred and demonstrate sustained change. So we want to see how you will take this idea and maybe modify it or develop it or roll into something else. That way there's some ongoing initiatives that continue to retain and advance gender equity for faculty members. Okay, next slide. Starting with the judging criteria, 40%, which is the largest chunk of what the judges will be looking for, is the impact. With that, we want to understand what approach or combination of approaches that your group has developed. And this will be evaluated based on the magnitude and extent of impact seen on improving gender diversity at the institution and or department, division, school. One consideration that we want to bring to your attention is faculty of intersecting identities, such as women of color, women's abilities and such, and other sorts of intersecting identities in some of your programs. So if you have enough information and you want to report that, that would it would add a bit of depth to the application or the submission. So we have here description of the approaches. So we want to know what's your approach. Why did you pursue this approach over other ways of addressing identified barriers? Maybe this is something that had a low barrier for activity. Maybe there was it didn't need a whole lot of time to set up. Maybe it's something that didn't need a whole lot of people in order to start this approach, or maybe there was some sort of change that the institution wanted to try, and so this is an avenue of doing that. So why why did you pursue this? And we were just curious about that. The method, how did you develop your approach? And what evaluation measures were conducted to determine or to confirm barriers or issues to contributing to gender diversity? So how will you measure the results and the outcomes of this? And then ultimately the outcome, addressing the magnitude of the intervention, your confidence in being able to ascribe the result to the approaches. So did this make a change? Did this, start maybe, if not, a change in numbers of faculty that are being recruited? Maybe it has something to do with culture and climate change. So how this change has occurred, and what the outcome of it is. So that's what we really want to know with this impact, and want you to describe to us. So that's the biggest chunk. And here is an example that I took from the literature on a career development program and their impact on retention. And so this example, though this would be for those who are tuning in today, we want you to measure what's happening at your institution. This is just something that's a bit broader because it's looking at nationally career development programs for women. And it took the AAMC data to compare women who are participating in career development programs from 1998 to 2008. So just a really long period of time, about 40 years, no, 30 years, sorry, math. And with 17,000, over 17,000 women and 40,000 men who are non-participant faculty, similar to the CDP participants. So it took a large chunk of women who participated in these events, and then it compared to men who were similarly staged and such, and also to women as well. And it found CDP participants were significantly less likely to leave the academic medicine to their peers, whether they be male or female, up to 8 years after the appointment as assistant and associate professors. So on the left-hand side, you have the graph, which shows the women and that participated in the career development in this kind of broken sort of line diagram that's going to step down. And then you have a comparison of women who did not participate in the solid dark line, and then men who it's in kind of like the gray line in between. And so what they found that those who participated in these sorts of programs would tend to stay at the institution and tend not to leave. So this is just one example of something that's happened, and this is more on just a general national scale rather than the institution. But we're looking for examples like this that can show, how over time a program has worked. And it could be whether a short period of time, a longer period of time, that's up to what metrics that you provide. Next slide. Continue with the judging criteria is the metrics. And so we need to, not we, but we mean judges who will be evaluating, will need to see a pre-intervention and post or current intervention sort of changes if it's something that's still ongoing. So you must submit the minimum metrics for the institution, school, division, or department in order to apply. So we want to know what the baseline is. So aggregate faculty demographics for however large the unit you break it down that have had the intervention, to which approaches, or the interventions apply. And then we would like to know the proportion of absolute numbers, and then the post-implementation. So things that have happened after the intervention. And this breakdown is, we want to know faculty by gender, by faculty rank, and tenure type. So that's kind of the basic information that we need for this. Next slide. Now, with the intervention that you design or that you report on, there are some optional metrics that you could include in this. And so there could be metrics on climate and culture, recruitment and hiring, support, retention, and promotion. And these are just examples. There are additional examples that are located on the Enhancing Faculty Development platform site, and the website will be at the end of the slide deck. You can have additional as examples, and the site also, the platform also has resources for articles and additional metrics and guidelines as well. So it's a very rich site. Hope you'll visit it. But here we just have 3 different categories, and your intervention may be something that falls within this, may be something that's completely different. But this adds color and depth to the submission. And so please include as much data as possible so we can understand how things have changed, because you may have information about the pre and post intervention when broken down on gender, faculty, and rank and tenure type, but you may not necessarily see a dramatic change, but there might be a change when it comes to who's engaging in leadership. It might be a change on who's being featured in speaker roles. And there are other avenues of measuring change that don't necessarily relate to just general demographic changes that we have mentioned, which is the minimum. So make sure that you add as much context with additional metrics about your intervention as possible. And I did see questions that popped up. Maybe.
Yeah, there's one question relevant to what we're on
Okay.
now. Maybe the others we can save for the end. This question is regarding the minimum metrics on the last slide. When you say tenure type, is identifying what tracks are included in the data acceptable, or do you also want the data to be broken out by gender, rank, and tenure type? Can you define tenure type?
So tenure type is if it's non-tenure, if it's on tenure track position. That's typically what happens at number of US-based institutions, institutions that necessarily mention tenure type. And if that's the case, then please note that in your document that we don't really offer a lot of tenure, or we only offer tenure to full professors and no one else tends to get tenure. So there's ways of sharing that information with us. And we don't, we just want to get kind of aggregate faculty demographics when it comes to some of this data, how many are in the faculty tenure type, not necessarily if, this particular woman at this associate level is also tenured, just you can get an aggregate of that sort of data. That way we could see, if there's a change, because maybe your change isn't necessarily who is, maybe there isn't a big change in the numbers of gender diversity, but now there's a change in who's advanced over time, who's gained tenure over time, so these are other ways that we can tell changes have been made. Hopefully that helped answer the question. That we can revisit in the Q&A session. Okay. So these are the last 3 parts of the judging criteria. Sustainability, to the extent of which effective efforts to enhance faculty diversity in institution can be regularly monitored, sustained, and are long lasting. So maybe the department has a 10-year plan in order to increase, faculty diversity, and maybe the intervention that has occurred was maybe a 2-year period how will that intervention be rolled into other efforts? Have that sustaining, enhancing effect on the either recruitment or advancement of faculty that is in the department. So looking at taking a longer view and how maybe you started a pilot sort of program and how you plan to build that out in the future is another way of monitoring sustainability. So how does this become part of the culture in your institution as well? Like maybe this is something that did start within one school, but now it's branching out to maybe the School of Arts and other sorts of programs. Maybe there's some sort of larger like mentoring program that now started within one group and now it's spread further. So that's sustainability, and actually that's also addresses some of the scalability as well. So when it comes to scalability, we want to know how this can be built out to more than just your institution or your office, or not your office, your department or division. Whether or not, like I mentioned before, this is something that branches out to other schools within your institution, or it branches out to other institutions. So now maybe you partner with another regional school or another I guess if you're in like a statewide kind of network, like UTs or something like that, then maybe UT San Diego works with UT Austin. How do we branch that sort of intervention out wider to create this sort of network that can build upon itself? So think about that. And it doesn't necessarily need to be from institution to institution. It could be from school to, the wider institution, but how does this program get bigger? Is there an avenue for it to get bigger, even if it has yet to, been implemented? So what are you envisioning this for the future? And, or maybe how you share information in that regard as well. So maybe you don't enact the same program, but now you're sharing such information from the program to, a larger public or other institutions. And the last part is the lessons learned. So we know that when change happens, usually there's kind of like friction points that occur. And what we hope and want you to do is to identify some lessons learned in this as well during the implementation, because we would ultimately hope that this will be shared to the general public during the Winners Forum, and how you can share like some strategies on how, the challenges you face and how you got around these challenges, because there may be institutions that might be similar, whether they be rural or extremely urban or a liberal arts college, or, it's, maybe community college or so, but other institutions that may have similar characteristics may learn from some of your strategies, or, other institutions that may be completely different, that have the same sort of challenges. And that is important to see, that there's kind of this connected thread that's there, and that your institution was able to, get, like I mentioned before, get around it, or, solve and resolve these sorts of issues in order to enact said intervention. So we want to know that this is not a weakness, to understand that there's challenges out there. We all know there's challenges. Giving voice to that also gives strength to, change in the future. Next slide. So the submission timeline and the judging process. This is the last webinar before the deadline of April 16, 2021. Now, there will be avenues for you to contact us for questions in the website, and also I have an email that's on the last slide, so you can reach out to us. But we just want to just give you an overview of the structure of this, and hopefully if you had not had the chance to look at the submission guidelines and such, that you will do soon in order for us to, help answer your questions, because we're really excited. We really want to see your solutions. And I believe really quickly, I did see something out the corner of my eye about who's judging this. I hope that was one of the questions. So the submissions will be judged by a panel of federal employees. So this will be federal staff that are engaged in career development, training, workforce development, women in science, trainees, that certain diversity initiatives, not only at NIH, but other agencies as well. So we wanted to, of course, when we do a challenge, it's you always have to be cautious of avoiding conflicts of interest, and it's hard to get. And the way that the challenges are designed, it's not like a typical peer review that would go out, because those who are engaged in peer review may want to apply to the said challenge. So this is due to this type of mechanism, then it's just judged by federal employees. The winners for this event will be announced in late July after the judging has concluded. And then the winners forum will be held in early October. Next slide. Some more information about the winners event. It will be a 100% virtual event, and that is because we are, as you know, still battling with COVID. Originally, of course, we had wanted something that was in person, but we want to make sure that everyone's safe, and this will be a one-day panel discussion as structured currently. There will be virtual meeting with keynote speakers when we're discussing with a few different partners with now to add them to the roster for speakers. And winning institutions may be selected to provide 10-minute presentations. And we have, we currently have structured something that we structured an agenda that will have maybe about 3 different 10-minute presentations, but that may change depending on the number of additional speakers that we have for the event. But we want to make sure that all of the winning solutions are shared, and all winning institutions will be invited to be on the panel discussion to collaboratively share, your feedback and your strengths, and to the community. So we're really excited about having this event and hearing more about, what you found and what's worked for you. Next slide. As promised, here is the submission website. So for submission and questions regarding the platform and other sorts of questions, right here, right below is the HeroX at NIH Gender Diversity Prize. And this is where you'll get the information. This is where you'll be able to submit your application. And if you have additional questions about eligibility or some clarifying questions about the rules and such as well, or other other questions that pop up, you can contact the prize managers. We all man the mailbox here at ORWH Prize 2020. And I am going to pass it now to Kyla. Thank you.
Great, thank you so much, Teraya. So I'm just going to change my screen share. And while I'm doing that, just a reminder to everyone that if you do have questions, you can put them in the Q&A box at the bottom of your screen, and we'll be getting to those in just another minute or two. So right now you should be looking at the challenge page on the HeroX website. This is the page we've referenced a few times, and if you have not already been on here, I highly recommend you go and check it out. I'm just going to point out a few key parts of it for you to take a look at. The first is this overview section, which will give you a high-level overview of the challenge, very similar to what you heard today. And on the second tab is the guidelines. And this is really the meat of what your application needs to include. If you haven't read it, have a read through. It includes things like the timeline, submission requirements, those judging criteria that Teraya was talking about earlier. And it also includes the submission format. So it will be a fillable submission that you need to complete. So definitely go in and take a look at the submission format. Some other things I'd like to point out on this website. One is the forum. So if you have any questions following the webinar, again, this forum is where you can put them, or you can contact that ORWH email. If we get a question that I need help from the ORWH team, I'll forward it to them as well. So either way, you're getting to the same people with your questions. We also have this resources section where we've added some great resources that we think are really helpful. If you're looking for more information on this, they're not necessary, but a good place for you to take a look. In addition to that, we also have this guide to metrics and data tab. And this talks about those minimum metrics that Teraya was mentioning earlier, as well as the optional metrics that are meant to give you an idea of the diversity of the types of metrics that you can include. This is also where you'll submit your application. So when you're ready, just click this orange button to get started. If you're not already signed up on the page, I highly recommend you do so. You can either do that by clicking this follow button here, and that'll subscribe you to updates from us, like this webinar recording, deadline reminders, all that good stuff. And you can also just click this orange button and you'll get to see the start of the submission form. And you can go in, edit your submission form as much as you like prior to the submission deadline. So do go in and test it out. Okay, with that, we are going to move into the Q&A portion of our webinar. And I'm going to start with a question around low or limited institutions. So this question is, what is meant by up to 5 low or limited prize recipients? Could a 0 low limited institution receive an award? This institution in particular is self-funded for their gender diversity initiative, and they think they probably can't overcome disparities that will exist in applications based on the availability or external funding for the program. Can you speak a little bit towards this lower limited institution prize pool?
Can I step in first and then see if my team will have more to add? So what is meant up to 5 in low limited prize recipients? So we have the pool split. There are 10 total prizes that one could that we have. So for a total of $500,000, each institution would be awarded, a winning institution would be awarded 50. But we wanted to make sure that we didn't compare our one institutions to those that are more limited in their scope. So if you are familiar with the NIH sort of grant mechanisms, typically like an R15. And Cecilia had mentioned the 2 categories that fit within that, which is the $6 million that is limited. So within a 4-year period out of 7 years, and that's what's meant by the low and limited prize recipients. And up to 5, we'll have 5 in the reserve for the limited institutions, and then we have 5 for the typical R1 institutions. Now it is possible that 0 low or limited institutions could receive an award, and that would be if no low or limited resource institutions applied. And so that is a possibility that, if they didn't apply, there's nothing to judge them, or we just won't be able to, award anyone. As a limited resource institution that self-funded, done some amazing things, which is congratulations. But it's not, and we understand that you probably cannot overcome the disparities. And that's why we had that as a separate pool. That way, limited or institutions can be compared amongst themselves rather than to the R1 institutions. We don't want to compare someone who, institution that has millions of dollars and, $1 billion endowment to, those that are considerably smaller. That's not fair. And we want to make sure that we recognize your interventions as well. And we just want to make sure that we are as inclusive as possible. So yes, we welcome. Please, with your amazing things, please submit for the prize.
Thanks so much, Teraya. Okay, the next question I have is about character limits. So each question in the submission form does have a character limit, and because you're submitting your application via a fillable form, those character limits will be hard limits. They do include spaces, and the question here is, do they include images like a chart or graphic? And no, they do not. So you can include images, you can include a table if there's text in your table, which presumably there would be, that counts towards your character limit, but the actual feature of having a table does not take away from your character limit. Okay, I'm going to pass the next question to Dr. Ghim. If graduate schools are associated with undergraduate schools, how would you classify them? Would you separate the graduate school campus if it is on a different campus from the undergraduate school in determining total NIH direct and indirect costs?
Okay, so I apologize. I think I clicked on the wrong button earlier for answering live and it was never answered. So thanks for the opportunity to actually provide a response. So, on the challenge.gov website and also on the submission website, there is a way to drill down just a little bit to figure out how to make this calculation. There is a link that I really like to point out under eligibility, right? That will take you to, let me get to the exact link. I'm sorry. It's under rules, eligibility rules for participating in the prize competition. There is a link, a determination page. It will take you to the report or reporter website where you can put in your institutional information. It does get a little bit complicated, because if you look at the instructions, it does specify what sorts of grant mechanisms, programs, and components of your institution to include in this calculation. So we do ask you to take a look. Generally, institutions would self-certify their eligibility. This would really only be an issue if more than one component of your institution might be applying. So we do ask you to coordinate as to which pool you would be put into. This is something that if you can't figure out through the links that we provided, you can contact us offline. We do also encourage you to talk to your business office at your institutions, because they're used to doing these sorts of calculations and probably already know what sort of category or what to include in this determination.
And I also want to clarify that with the rules, there's only one submission per institution. So whether that be broken down to a specific department or that be broken down within a school, within an institution. So you should talk to your business office to make sure that other parts of your institution are not in the process of applying. So it's only one application per total institution.
Great, thank you. And I know there's a follow-up question that I think was submitted right before we started answering about gauging unique applications from an institution. I think we've now covered that, but Teraya or Melissa or Cecilia, anything else you'd like to add to clarify this question?
I can add just a little something to this. So in addition to, the guidelines that we just sort of went over, generally, medical schools have a different, are considered a different institution. So this is also something that you can check with your business offices for, but usually if there are separate campuses, like to use Johns Hopkins as an example, Johns Hopkins Medical School is actually considered a different institution than the main campus, or even they have a variety of different schools and they're all considered different institutions. The different California schools with different campuses are considered different institutions as just examples. So definitely check with your business office and they should be able to provide that information.
Great, thank you so much, Melissa. So we are just a few minutes over the 45 minutes that we had for today's webinar. There were a few questions that were submitted prior to the webinar that were asking about things like the current state of gender diversity or recommendations for how they can improve. And so I'd like to point you to that resources section that I shared on the HeroX page. There's lots of phenomenal resources there that you can take a look at to understand the current state. And then of course, the winners event that we're holding in October is meant just for that, to help disseminate some of the amazing work that's being done in institutions across the US. With other institutions and other people who are curious to learn more about how they can support. With that, I would like to just extend a large thank you to everyone who attended our webinar today. We are really excited to see your applications. We're excited to support you through this application process. If you have any questions, the forum on the HeroX page or the ORWH email is the place to go. And to go ahead, Teraya.
Oh, I did have one additional question. I'm not sure if we got to the character count for the graphs.
Yes, I did.
Okay, we did. Okay, I'm sorry. Okay.
No problem. And there's one last one that's sneaking in as well. We are doing a single joint nomination between 4 units within the larger university. Is that potentially problematic?
No, because then you would put in as an institution. So it is within the university, and you will just clarify that it's 4 units that are sharing in on one or more interventions. What we just don't want is the case where, say the biology department is doing something, the chemistry department is doing something, they're completely separate. Now they're both applying, to this. And so we want to make sure that we recognize the, with all the scalability, and, we want to recognize, just one sort of unit within, the institution or the institution itself. So it could be the whole institution, and with the 4 units within the institution, you could say that it's the institution, or 4 departments, and just come in as that unit, rather than 4 separate applications that are coming in from, one school. That's what we don't want to see. So.
Awesome, thank you. And with that, I hope everyone has a great rest of your day. Thank you, Dr. Donaldson, Dr. Ghim, and Cecilia. We really appreciate your participation in today's webinar, and we're looking forward to seeing your applications.
Thank you, everyone. Please apply. We're so excited.
Thank you.
Bye.